Cervical intraepithelial neoplasia is today's topic. Cervical intraepithelial neoplasia is defined as degrees of dysplasias arising in the epithelium or outer layer of the cervix. Now, cervical cancer is the most commonest cancer encountered in clinical practice of obstetrics and gynecology in Indian context, and this cervical intraepithelial neoplasia is a precursor of cancer cervix. So, the thing to realize in this slide is that these dysplastic cells arise from the epithelial. The basal 1/3 of epithelium is involved first, and then it grows up to the 2/3 of the epithelium, and then the entire thickness of the epithelium is involved. The basement membrane is still intact in cervical intraepithelial. Since the basement membrane is intact, it is called as intraepithelial. After the basement membrane breach happens, then it becomes a microinvasive carcinoma. So, abnormal cells spread into deep cervical tissue and it is called as microinvasive carcinoma. Now, why cervical cancer is still the most common cancer of women in India? Because in Western countries, there has led to a drastic decline in the number of CS cervix because of the universal application of pap smears and liquid-based cytology, which we are still to do in India. Now, the average age of presentation is 35 to 45 years, or early coitarchy before the age of 18 years, multiple sexual partners, and delivery of the first baby before the age of 20 years when the transformation zone is still immature. Now, the other high-risk factors are multiparity, poor personal hygiene, poor socioeconomic status, smoking, drug abuse, and in women with HIV, human papillomavirus, and sexually transmitted diseases. So, normal cells may become cancer cells over a period of time. Normal epithelium becomes hyperplastic becomes dysplastic, and then finally cancer develops. So, women with pre-invasive lesions, immunosuppressed individuals on corticosteroid therapies or HIV or disease modifying agents, or women using ossipils for more than 8 years can also be prone for a special type of carcinoma cervix, which is adenocarcinoma, which is the second most commonest variety, the commonest cancer cervix being the squamous cell variety. Now, coming to the stage 0. The stage 0 of CS cervix is also called as a pre-invasive cancer or cervical intraepithelial neoplasia. It is called as intraepithelial because the basement membrane has still not breached. And cervical intraepithelial neoplasia refers to the histopathological description in which a part of full thickness of the stratified squamous epithelium is replaced by cells showing various degrees of dysplasia. However, the basement membrane is intact, leading to the terminology of intraepithelial. So, this is a slide showing the degrees of dysplasia. So, this cells is really dysplastic because there is a deeply staining irregular large nucleus, increased nucleocytoplasmic ratio, whereas this is a normal superficial squamous cervical cell. Now, coming to dysplasia. Dysplasia represents a change in which there is an alteration of cell morphology and disorderly arrangement of cells of the stratified squamous epithelium, and the cells may also vary in size, shape, and polarity. Polarity refers to the arrangement of nucleus in the cell, and as we can see, as the cells become more dysplastic, they become varied in size and shape and also in the arrangement and in the polarity of the nucleus. Now, there is an alteration in nucleocytoplasmic ratio. The cells reveal large irregular hyperchromatic nuclei with marginal condensation of chromatin material and mitotic figures, and these lesions progress with time and ultimately end up as frank invasive cancer. Now, other features of dysplasia are thickened nuclear membrane, clumped up chromatin, and the penetration of underlying basement membrane when it is called as microinvasive carcinoma. And when the microinvasive carcinoma happens, the cancer cells leak into the underlying cervical stroma. Now, this is how the cervical cells look on a pap smear, and this is the normal, this is the basement membrane, the normal arrangement of cells. So, reserve cells have got a bigger nuclei, and as the cells are growing towards the superficial part of the epithelium, they become more flat, their nucleus shrinks in size, okay. And in CIN1, there is these dysplastic cells are in the lower 1/3 of the epithelium. In CIN2, the dysplastic cells are in the lower 2/3, and in CIN3, the dysplastic cells are in the entire thickness of the cervical epithelium. Now, 4% of CIN will become cancer at the end of 1 year. 11% at the end of 3 years, 22% at the end of 5 years, and 30% at the end of 10 years will reach the invasive stage. So gradually they will progress from CIN1, CIN2 and CIN3, and these are all pre-malignant lesions of carcinoma cervix.